Hi, everyone. Nicole Baldwin here, nurse practitioner. And today we're going to talk about screening for lung cancer. And there is some recommendations for when you should be screened for lung cancer. For example, the recommended screening test for lung cancer is low dose computed tomography, and that's a CAT scan. It's recommended for adults who have no symptoms but are at high risk. So who should be screened? Based on the U.S. Preventative Services Task Force, if you've smoked for longer than 20 years and smoke now or quit within 15 and are between 50 and 80, then it's a good idea to get an annual CAT scan to take a look at those lungs and really get a good picture, make sure there's nothing abnormal going on. A chest x-ray just isn't quite enough. A lot of times we can see cancer on an x-ray, but it isn't until it's really, really advanced. So getting a CAT scan early, and if something is detected, it's much more treatable when it's small than when it gets really big. So your insurance may cover this. Most of them do, some of them don't. But it is important to get those done if you meet those criteria. And screening doesn't mean that we're testing for the disease because you have a history. Remember, we're screening. So we're just checking. Think of it like annual mammograms. Us women, we go every year just to make sure there's nothing growing abnormal. We want to check, because if it's small, it's much more treatable than once it spreads. Same for prostate cancer. We always want to get that checked, because once it spreads to the nearby organs, then it becomes stage 4. So the lung CAT scan is the only screening test used, and it does use a small amount of radiation, just like an x-ray would. It uses a small amount of radiation. It makes us detailed sliced images of your lungs so we can get a really good detail of what's going on in there. And it only takes a few minutes. It's not painful. You lay on the table, less than a couple minutes, you'll be in and out. And then we can take a good look at those and give you the okay, or the other way would be see what's next as far as treatment. So again, there is 3 criteria that recommends yearly lung cancer screening with the CAT scan. And that's if you've smoked for 20 years, smoke now, or have quit within the past 15 and are between 50 and 80 years old. If you meet those criteria, definitely reach out to your provider, get an order for screening.